The Say No model is a tool you can use to decline a request in a professional manner. And this is important because there will be times when you will be asked to do things that are not within your scope and role, and you will have to decline. In essence, you will have to say no in order to uphold your ethics. The Say No model is very easy to remember. It only has 3 steps: be gracious, offer 2 to 3 choices, give reasons. So easy as 1, 2, 3 to remember. Because while it is easy to remember the steps, it's not that easy to actually put it into practice.
If you don't feel like being alone tonight, Joey and Chandler are coming over to help me put together my new furniture. Yes, and we're very excited about it.
Thanks, but I think I'm just going to hang out here tonight. It's been a long
Oh, sure, okay, sure.
Hey, Pete, do you want to help?
Oh, I wish I could, but I don't want to.
Now, of course, I'm not going to teach you how to say no. We've all said no before. But what we are going to practice is using this way of declining a request or saying no. And we want to practice this because most of us are used to saying, I can't do X because of Y. I can't attend that meeting because I have a previous commitment. I can't help you with your homework because I'm not very good at physics. I can't go out this weekend because I'm broke. And sometimes we simply just say no without an explanation. Not many of us are familiar with the steps that the Say No model suggests that we should use when declining a request. So this means that you will have to practice using it. So let's take a look at each step a bit closer and practice using this tool. So on the screen here you see a few situations where you would have to say no. So if a patient asks you, can you tell me how I can get financial aid to pay for my hospital bill? In that case, interpreters should not assist or give any information because we don't work for the hospital. We are not up to date with their financial procedures. Even if we helped someone yesterday, today they could have changed the rules, and so we do not give this type of information. Which therapist should I see? That would be giving advice. So as interpreters, we don't do that either. Can you bring me a wheelchair? So someone from the hospital is asking you for a wheelchair or a patient. No, we cannot do that because if someone gets hurt using that wheelchair, then that is going to be our responsibility, right? Can you help me move from my bed to a chair? Definitely not. We are not trained to do this. And even if you are trained to do this, if you are working as an interpreter, then you must remain within your capacity as an interpreter and nothing else. Can you bring me juice from the kitchen? No. And I think this one might be obvious, but it also might seem rude to say no. But again, we don't know if the patient's sugar is high. We don't know if the patient should be NPO because they're having a procedure. We don't know if they should be having the juice, and we could harm the person more than help them. So this is another example where we would have to decline. Okay, let's take a look at one of these specifically and apply the Say No model. Okay, so the first one was, can you tell me how I can get financial aid to pay my hospital bill? So the first step is be gracious, and by that what we mean is you should validate the request in a culturally appropriate way. So for example, if in your culture being welcoming and showing someone that you understand why this is important for them, if a smile is appropriate, then you can smile. You can use a warm tone or a welcoming tone. You might also nod your head to communicate that you understand the request. So these are going to be things that are culturally appropriate to show being gracious in a professional setting. What you don't want to say is, the word but. I would like to help you, but. So here in the black and italics, you can see here that an example of something you could say for this step is information about financial assistance is very helpful for anyone with medical bills. So we can start with that. The next step would be to give 2 or 3 choices. So now this is going to be something that you're going to do if it's possible. So here are some choices that you could give. I could interpret for you while you ask the person at the front desk about financial assistance, or interpret while you ask them who could help you with applying. Now here's another tip. When you are performing this part of the say no model, don't offer more than 3 choices because too many choices can get confusing. And the last part of the say no model is to give reasons. I do not work for the hospital, so I'm not familiar with the resources they offer. Or another reason in this case could be, I'm not familiar with the hospital's financial procedures or financial assistance programs. But please don't use phrases like, I can't do that because it violates my ethics. And the reason why I warn about not using this phrase is because the person might feel or take that as you thinking that they are asking you to do something unethical. The other phrase that I very much warn not to use is, that's not my job. Because the whole purpose of learning the say no model is to be able to say no or decline a request in a professional way. And we don't want to seem like we don't care about the person. Because we are healthcare interpreters, we are seen as providers, it is very important that the patient that we interpret for, or even the providers that we interpret for, feel like we hear them and we understand them, we're willing to work with them. That doesn't mean that we say yes to everything, of course. So I would avoid using either of these phrases. So let's take a look at what that would look like altogether. Can you tell me how I can get financial aid to pay my hospital bill is the question. And it could sound something like this. I really wish I could give you that information. Information about financial assistance is very helpful for anyone with medical bills. I could interpret for you while you ask the person at the front desk about financial assistance, or interpret while you ask them who could help you apply. I do not work for the hospital, so I am not familiar with the resources they offer. Okay, so give that a minute to sink in, and then we are going to do some practice in this module.